So about a year and a half ago, I started to notice that my night driving was really getting quite bad. I noticed a lot more glare off of oncoming cars. I had more trouble reading street signs, and I knew that I was starting to develop lenticular aberrations in my right dominant eye. I noticed that my prescriptions started to change, and so I started to talk to everyone I knew. In our practice, we were doing a lot of premium IOLs, and I was trying to figure out what would be the best lens for me. And what I wanted was the highest quality vision, especially for night driving. That's what I knew. So I went on a quest, and I started to ask every single ophthalmologist I knew who did a large volume of cataract implants. And time again, even though it wasn't on my radar at all, people kept saying, you need to look at the light adjustable lens. So some of the surgeons that I spoke to were Dr. Stephen Slade, who trained me in LASIK, and Dr. Kevin Waltz, who I've known for the last 2.5 decades. And both immediately said that the light adjustable lens would be an amazing choice and would give me the kind of vision quality I was looking for. So after counseling patients myself for decades with regards to having, cataract surgery and refractive lens exchange, it was very interesting being on the other side of the equation and, listening to Kevin. And the discussion went a little bit differently than I had expected. Kevin, number one, was incredibly confident that not only would I be at least 20/20, which is what I was hoping for with great quality of vision, he was sort of questioning, whether I was going to be 2015 or 2010, which was beyond my imagination. He was very sure that the light adjustable lens was going to be able to give me a better quality of vision than I'd ever experienced before in my life. The pre-op was pretty standard. There was nothing complicated or difficult. Probably the most interesting part to me was that my best corrected vision had dropped by 3 lines over the past year and a half. So I really needed the surgery, as Kevin said. So the surgery went remarkably smoothly. I don't think it could have gone easier. I was really quite surprised at how easy the procedure was, and grabbed a quick bite after and just went to sleep. And the next morning, I got up at 5:30 in the morning and looked out the window of my hotel room. And I remember distinctly, pulling the drapes back and looking out at the skyline. And it was all dark, and I could see all the buildings, and I could see all of the digital signs on all the buildings and the street lights, and everything was clear. I didn't have any glare or haze or halos from any of the digital signage. None of the lights had that glare or starbursting that I expected. In fact, it was exquisitely clear as I looked out into the horizon, and it really surprised me. It really took me by shock, because I had expected this period of healing. I had expected, as Kevin had told me, that I was going to need, an adjustment, that this was a process going through. And here I was the first morning already completely happy with my result. So the next morning I went in and I saw Dr. Waltz, and they tested me, and I was reading 20/20 as I had expected, and the vision quality was extremely good, and I was quite happy. But Kevin said that we were still going to be doing an adjustment, and he was going to improve it, and I'd come back in about a week or 10 days. And we do a refraction and see. And what the refraction showed was that I was +3/4, -1/2 at 125 degrees. And frankly, I was happy. I could see great. But, as Dr. Waltz had insisted, we went ahead and did an adjustment. And when I went back to my clinic and I had them refract me, I was plano. I didn't even accept a quarter diopter of sphere or cylinder. It was really quite surprising. They tried to trick me. And when I was looking at the chart, I could actually read 2015 plus 3 letters on the 2010 line. Now, obviously I ended up with an incredible result, not just quantity of vision, but quality of vision, something that a lot of people don't talk about, but as an ophthalmologist, especially as a refractive surgeon, this is my life. And so, for me, I tried to do everything that I possibly could to make sure that I would get the best result and that I could lock it in. And Dr. Waltz was incredibly careful at instructions and telling me that even though I was a doctor, I still had to be a good patient. So I tried to be an extremely good patient, not a typical doctor when I went through the recovery. Dr. Waltz and his staff were very, very, very clear in terms of my instructions, and they had impressed upon me the importance of wearing my UV blocking glasses at all times, indoors and outdoors, until the lock-in procedure. So it's pretty much every single time I drive in the early hours of the morning or in the late hours of the evening, or especially in Atlanta when it rains, I really then, for the very first time all over again, it seems, come to realize what an incredible vision quality I have. I always used to find driving at night more uncomfortable. I always used to find driving in the rain more difficult, and I don't anymore. I can read street signs. I'm really comfortable. Oncoming headlights don't bother me the way they used to. And I think, as a refractive surgeon, this is what my patients want. And this is really what we need to try and deliver to every single patient that comes into us. Because it really is, as I said, 2020 just isn't good enough today. And just like Dr. Waltz spoke to me about having 2015 or 2012 vision or 2010 vision, this is what patients are seeking today with that high level of quality under all different lighting conditions. So I think that there is an incredible excitement around this lens. When I had asked my colleagues what I should have done, and now I'm telling other people this is what they should have done, it really is quite remarkable what we're able to achieve today. It's really interesting when you think of the way we have dealt with the premium IOL market in the past. So we'd have a patient come in, and nowadays a lot of baby boomers with a lot of disposable incomes and their smartphones and computers, they want to have the best vision. They don't wait until their 70s and 80s to have lens implant surgery. They're having it today in their 50s, and just like me. And so in the past, we would put a premium IOL in, maybe a multifocal IOL, maybe toric IOL, and then we would need to enhance them with LASIK in order to get the kind of results we're talking about. And this was probably about 1 in 10 patients who had a premium IOL. And frankly, even though I told them ahead of time that, you may need this adjustment, you may need this additional procedure, the fact that I went from an intraocular implant procedure to this other LASIK laser procedure, a lot of them kind of felt like, okay, you missed the mark, you messed up, now you're trying to use this other surgery to fix what you did wrong, as opposed to what I went through with the light adjustable lens, where it's an expected part of the process. It's a step-by-step. You're doing everything on the implant, which is going to stay in your eye. It's not a separate procedure. It's not an additive procedure. And therefore, no one feels like, oh, they missed the mark or this wasn't right. They feel like, okay, I'm going to fine-tune this implant that's in my body now to give me the absolute best outcome possible. And I can live with it, you know, if I want to be a little nearsighted or I want to be bang on perfect distance, and then have it locked in. I think for any patient, doctor or not, who wants to have the absolute best outcome assured, then the light adjustable lens is for you. Because not only will you get the refractive outcome you're looking for, you'll get the quality that you've always hoped for. And there's no question that with this lens, your surgeon's going to be able to achieve it.